Hey guys, this is my Write and Discuss a Case Study assignment for our current module. So I decided for this case study, I am a reproductive endocrinologist who is based in Dallas, Texas. I have been practicing for about 5 years now at UT Southwestern Medical Center. I serve as a fertility specialist who analyzes and diagnoses everything from in vitro fertilization to polycystic ovarian syndrome. The field of reproductive endocrinology is a subspecialty of obstetrics and gynecology that requires 4 years of medical school as well as a 4-year residency, followed by 3 years of intensive training in my chosen field. I see around 50 patients a day on average. The scenario in this case study is the medical condition called endometriosis. Endometriosis is a painful disorder in which the inner lining of the uterus, called the endometrium, that is normally shed during the menstrual cycle, grows outside of the uterus itself. The ovaries, fallopian tubes, and surrounding pelvic tissues are usually the areas that are affected with this disorder. This in turn leads to increased pain and blood not leaving the pelvic cavity through the vagina as necessary for the female reproductive system. Further complications arise with conditions such as infertility, dysmenorrhea or painful periods, painful urination, and painful intercourse. I see the condition as often as nearly half of the women I see are suffering from endometriosis in regards to fertility issues and failed pregnancies. So about 49 out of 100 cases. When endometriosis cases present themselves, I treat them based on severity. You can have someone who is seeing the early signs of endometriosis and is easily treated, and you can see someone in the late stages of endometriosis and they might require something as drastic as a hysterectomy. So I opt for both hormone treatments by way of oral contraceptives, such as birth control and pain medication, to manage the diagnosis. Like I said, hysterectomies may be proved to be the only option in severe cases. In this case study, our patient's name is Sarah for doctor-patient confidentiality purposes. Sarah is a 19-year-old college student attending Texas Women's University as a journalism major. She is of Latino American descent, and other than her left arm being broken in the 2nd grade when she fell off the playground slide, she has a perfect medical record to boot. She complained of having heavy, irregular, and often sometimes painful periods over the last several years, but thought nothing of it since all her friends complained of similar issues. She has a mild form of endometriosis that is only starting to develop since the pain became unbearable in recent months, and she decided to come in for a consult. She comes from a religious family who doesn't believe in sex before marriage. Therefore, they don't believe in contraception or the use of contraception before marriage. So I went ahead and prescribed her Mirena, which is a progestin-only contraceptive to control her hormones and lessen the pain. It is a small Y-like it's a plastic that is inserted into the vagina. It releases hormones into the body to control symptoms of endometriosis and prevention of pregnancy. In regards to treatment and diagnosis for endometriosis as a whole, as a big picture, I recommend that health and education to put emphasis on listening to your body from the beginning. It should also stress the importance of seeing a healthcare professional if abnormal symptoms occur as soon as they arise, rather than waiting as conditions can worsen and prove devastating in cases of hysterectomy and not being able to conceive, not being able to have children, which is awful. Normal symptoms in the menstrual cycle should come with an understood concept of what is normal and what would be abnormal. Painful levels, everybody ranges. I know that not every woman's body is the same, but we need to outline that if you're having severe pain or, a heavy flow that isn't anything like you've seen before, or you have sudden changes, you feel different, then you need to come in and see us and have a consult. Hormone changes that occur in the female body. When it comes to addressing healthcare professionals treating endometriosis, all I can say is dig deeper into the problem and also pay attention to the body's distress signals. You are there to see what's not wrong, and I urge you to not overlook those signals and just dismiss it as pain or just excessive bleeding, and not just to address it as what it is. I encourage you to maybe get to the root of the problem for things that can be preventable, or you can prevent further damage from occurring. Don't overlook or dismiss the pain or infertility as just that, pain or infertility. Thank you.